Well, cold and flu season is here. COVID is still here. RSV is here. Lynn, Herr of the Vanderburgh County Health Department took a few minutes from our busy schedule to stop by and kind of give us an update and also give us some tips on staying healthy with this new variant. I just go, whatever, whatever.
So really things haven't changed. Remember back when we were all being so careful with COVID, you know, just stay in kind of a little distance in between somebody. Make sure that you're washing your hands all the time. Every time you think about it, wash your hands, you know, and then really also encourage family, friends, people that you know. If people are sick, please stay home. Please, please stay home. As far as RSV, please don't kiss the babies. I know that you want to. I know that everybody wants to kiss the babies, but don't kiss the babies. Again, washing your hands, having clean hands before you pick up an infant is just so important.
For everybody's sake.
For everybody's sake. We know that that is our #1 thing, you know, kind of to keep us healthy, is to constantly wash our hands. Keep that hand sanitizer. It works great too.
It really does. Let's talk about RSV and the number of adult cases. Now, I guess adults have always gotten RSV, but we're just hearing about it more?
Maybe we're hearing about it a little bit more. I think people are much more aware of contagious disease. RSV's been around for a long time. It does affect our infants the most. Of course, all these viruses you know, attack the most vulnerable, or those are the folks that get sick the worst. But those babies get sick a little bit more. Their airways and, you know, their breathing tubes are just so small. And you put some mucus in there and they can't get over it. So they really get into trouble.
And I know we've had lots of hospitalizations with adults and children. Where are we as far as the hospitals are concerned with COVID right now?
You know, I think everybody is just kind of in a holding pattern. This time of the year is historically, you know, kind of bad for contagious disease. So we know that, you know, when you pile flu, COVID, and RSV, it can strain staffing. It always has this time of year.
Well, we know that vaccines work, but and where are we? I mean, I just saw an article from the national I guess, vaccine doctor who's saying they're there, but people aren't getting them.
Well, you know, I think we're spread out, you know. There's a lot of place to get vaccines. So I encourage people to get their vaccines. It's not too late to get a flu shot. It's never too late to get your updated booster. All the local pharmacies have them available. The health department, if you don't have insurance or underinsured. And then we're really also working hard with our new mobile bus, our truck that's out, and we try to be in neighborhoods and places of the most vulnerable, and to make sure that we have flu and COVID vaccine available for those individuals that maybe can't get to a pharmacy or can't get to their doctor's office.
And they can call your office too, can't you, to get further information about that?
Area code 812-435-2400.
Now, we're going to talk more about this next week, but kind of give us a heads up on the event that is coming up that is such a big deal. Yeah.
Okay.
Yeah, we should be back next week to talk about that, but they need to mark their calendars for this day.
February 17th,
all right,
an infant mortality summit.
And it will be a very important opportunity, so we'll tell you more about it next week. Thanks for being here. It's always good to see you. First time in person.
I think so.
Yes, since
after
before
a couple
COVID.
years.
Yes.
We did it on Zoom all the time, but never did it in person.
Love to see you. Thank you, Lynn.
Oh, thank you for having me.
More Lifestyles right after this. Stay with us.